Hello and welcome to BORNO Health Update. My name is Ibrahim Amarawa. Health Update, as you are aware, is a program designed to update you on Governor Zulum's transformation drive in the healthcare sector under the stewardship of Professor Baba Malumgana, the Commissioner of Health and Human Services, BORNO State. The BORNO State government continues to receive commendations from within and outside the country for successfully hosting the 2024 National Council on Health here in Maiduguri, the BORNO State capital. Despite the flash floods on September 10th, which submerged more than 40% of the state capital, the 65th National Council of Health remained one of the best NCH events in the history as a result of untiring efforts of Governor Zulum's administration and the resilience of the good people of BORNO State. In his address of welcome, the Commissioner of Health and Human Services, BORNO State, Professor Baba Malumgana, enumerated the importance of the gathering towards improving the well-being of Nigerians.
We are honored to host this critical gathering of Nigeria's health leaders, policymakers, and advocates who share a commitment to advancing our nation's healthcare system, and it is an invaluable opportunity to collectively address the pressing health challenges that affect the well-being of our citizens. This year's council meeting provides an unparalleled opportunity to align our collective strategies, build synergies, and reaffirm our commitment to delivering equitable and quality healthcare to every Nigerian. On behalf of His Excellency, the Executive Governor of BORNO State, Professor Babagana Omara Zulum, CON, MNI, FNSE, I extend heartfelt greetings to the Federal Ministry of Health, ably led by Coordinating Minister, Professor Muhammad Ali Pate, whose transformative leadership has ushered in an era of renewed vigor in Nigeria's healthcare system. The theme of this year's meeting, accelerating pathways to universal health coverage strategies for 2030, could not be more relevant. It speaks to our shared responsibility to ensure that every Nigerian, regardless of location or background, has access to affordable, quality health care. Here in BORNO, we understand the importance of this mission profoundly. Our journey to strengthen healthcare services has faced unique challenges, but we have made determined strides to rebuild and expand health systems, especially for our most vulnerable communities. The Council meeting provides an invaluable platform for us to share insights, explore innovative solutions, and strengthen our collaborative efforts to advance healthcare delivery nationwide. Our discussions will focus on key pillars that are essential to achieving universal health coverage, which underscores our collective responsibility to deliver quality healthcare for every Nigerian, regardless of location or circumstance.
After 5 days of intensive deliberation on policies and programs aimed at providing accessible and efficient healthcare services to Nigerians, various decisions and recommendations geared toward improving the entire health system were made. At the end of the council meeting, a communique of the council resolution was presented by the Permanent Secretary of the Federal Ministry of Health, Dr. Daju Kachel.
The 65th National was accelerating pathways to universal health coverage, strategies for 2030 success, with the following sub-themes: health workforce development, building capacity for quality healthcare delivery in maternal and child health, community engagement and health promotion, empowering communities for better health, and innovations in digital health, transforming healthcare delivery. A total of 1,150 delegates participated from the departments, agencies, and parastatals of the Federal Ministry of Health and Social Welfare, State Ministries of Health, and the Health and Human Services Secretariat of the FCTA. Others in attendance include the members of the State House of Assembly, BORNO State House of Assembly, the leadership of ALGON, members of the State Executive Council, representatives of the National Population Commission, the Department of State Services, representatives of the armed forces and paramilitary agencies, and also in attendance were delegates from development partners, civil society organizations, organized private sector, health professional regulatory bodies, health professional associations, traditional rulers, as well as the press. The technical session. The council session was preceded by 2 days of technical committee meetings under the chairmanship of the Permanent Secretary, Federal Ministry of Health and Social Welfare, SNNI, all 36 states of the Federation, the Permanent Secretaries of the 36 states of the Federation, and the FCT participated in the technical session. During the technical session held on the 18th and 19th November 2024, there were technical presentations and panel discussions on the following subthemes: health workforce development, building capacity for quality healthcare delivery in maternal and child health, and innovations in digital health, transforming healthcare delivery. A total of 81 memoranda were considered. 29 were from the Coordinating Minister of Health and Social Welfare, 48 from the State Commissioners of Health of the 36 states and the FCT, while 4 were from other federal MDAs, the DSS and the National Population Commission. After extensive deliberations, the technical committee recommended 18 memoranda to Council for approval, 40 memoranda for notice, and 18 were recommended to be stepped down while 5 were withdrawn by the originators. The Council session. The Council session was held on the 21st and 22nd November 2024 under the chairmanship of the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate. Members of the Council include Honorable Commissioner of Health of the 36 states and the FCT. A welcome address was given by the Honorable Commissioner of Health, Borno State, Professor Zulum, and goodwill messages were taken from invited dignitaries and stakeholders in the health sector. The opening remarks were delivered by the Honorable Minister of State for Health, Dr. Isiaka Salako, followed by a keynote address by the Coordinating Minister of Health and Social Welfare. The 65th NCH was officially declared open by the Executive Governor of Borno State, His Excellency Professor Zulum, while the vote of thanks was given by the Permanent Secretary, Federal Ministry of Health, MNI, to end the official opening ceremony.
In another development, the Borno State Ministry of Health has inaugurated State Emergency Medical Treatment and Ambulance Service Committee aimed at reducing the maternal and neonatal mortality rate to the barest minimum in line with Governor Zulum's 25-year development plan. Let's hear the importance of these services to the well-being of the Borno people from the Commissioner of Health, Professor Baba Malimgana.
Gratitude that I welcome you all to the onboarding ceremony of the State Emergency Medical Service and Ambulance System program. This transformative initiative, supported technically by the National Emergency Medical Services and Ambulance System, represents a pivotal step in addressing critical gaps in our healthcare delivery system, particularly in emergency response and referrals. Within Nigeria, the regions that have the highest maternal death are the Northwest and the Northeast. Unfortunately, Borno State is one of such states. There are 172 local government areas in Nigeria that have dragged the name of Nigeria downwards in terms of maternal mortality and morbidity and neonatal morbidity and mortality. In Borno State, we have 13 such LGS. We are number 3 in Nigeria, after Kano, Katsina, and then Borno State. In many of these instances, these preventable deaths are tied to a broken referral system, where delays in moving patients from communities or primary healthcare centers to higher levels of care prove fatal. There are 3 main reasons for this carnage of our young women in Borno State and in Nigeria. One is indecision by the patient to go to a healthcare facility because the family will urge her to carry on, you will deliver the baby. Until when it's too late, then they said, okay, go to hospital. And when they decided that she can go to hospital, unfortunately, there is no transportation that would convey that woman who is now in dire strait to a respective healthcare institution. And thirdly, even when she arrives in the hospital, the setup may be inadequate for her to be addressed properly. And thirdly, looking at the consultant hematologist, our blood transfusion services are not up to scratch, if I can use that word. The absence of a functional ambulance system, therefore, has too often left families helpless in times of medical crisis. Today's event is a testament to our collective commitment to addressing these challenges head on. In some developed countries and most developed countries, they've even moved from not just emergency ambulances, they've moved to air ambulances. If there is a crash on the motorway, an air ambulance will be summoned and will arrive and within minutes would deliver the patient to the nearest hospital facility, which have been in touch with the ambulance, air ambulance, by radio message. So this initiative is especially significant as it stems from the resolutions of the recently concluded National Council on Health, which was held here in Maiduguri a couple of weeks ago, which emphasized the need for strengthened referral mechanisms as a cornerstone of achieving better health outcomes. This is a great measure by Borno State government in reducing the devastating effect of morbidity and mortality amongst the poor and vulnerable Borno State people as a result of lack of emergency medical service and ambulance scheme. Allow me to salute and commend our visionary leader, our people's governor, His Excellency Professor Governor Zulum, CON, MNI, FNSE, whose tireless efforts continue to reshape the health landscape of Borno State by consistently allocating over 15% of the state's budget to health. In line with Abuja Declaration, he has set a benchmark for prioritizing the health and well-being of our people. The budget for 2024 was 15% and for 2025 was 15.5%. So this is the focus of His Excellency on healthcare in Borno State.
Responding to the questions asked by the journalists regarding how quick and efficient this service will be, Professor Baba Malam Gana testified that allocating more than 15% of this year's budget to the healthcare sector is a clear testimony of Governor Zulum's commitment to the well-being of his people, and the ministry will continue working assiduously to the success of the program.
As we have highlighted today, deaths of young women, of which pregnant women, especially in Borno State, at any point in time we have over 400,000 pregnant women in Borno State, and we're losing well over 1,000 out of 100,000 in Borno State. This is, as you know, pregnancy is not a disease. It's a physiological phenomenon, and therefore people should not die in the process of, having childbirth. So it's something that is really worrisome, not only just for Borno State, which has got 13 local government areas which have got this very high maternal mortality in Nigeria, but also Nigeria as a country. So we have to hit the road running. His Excellency has already given us the marching orders. He has demonstrated clearly 2 years running, he's giving us 50% of the budget. And therefore we want to make sure that we hit the road running and bringing this, what we have discussed today, into fruition. We're very serious about it, and we'll work on it, and we'll deliver as per His Excellency's mandate.
We understand that there's a trust deficit amongst the people, and we would like to encourage the people to trust the government. Look at what the governor has been doing, His Excellency, which we are really proud of. There's a lot of development in the society, and look at this program as one of those programs that will really help in improving the livelihood and the health of the populace. Also, look at the body language and the ethos of the Coordinating Minister for Health and Social Welfare, Professor Mohammed Ali Pate. He has come with the notion and with a zeal to ensure he changes the story and the indices. He normally uses the word, we're looking towards the North Star. And this is one of the pillars of his intervention, ensuring that no pregnant woman has to die because of pregnancy. So Borno State has a mixture of both humanitarian and development contexts, and some contexts are within the position of recovery. So in Borno State, this program will help address the second delay in reaching adequate obstetric care for pregnant women. It will also serve in providing a missing link in the health system, a referral link for people that want to access emergencies in facilities, both public and private. Now it also takes away the burden of out-of-pocket expenditure for the populace, whereby this basic healthcare provision fund, emergency medical treatment gateway fund, which is 5%, will be provided to ensure the poor, vulnerable and indigent are not sent away when it has to be instances of emergencies.
The plans are already afoot. As I've said earlier, we have a B-Mama program, which training is going to be commenced in January. So therefore, as soon as all the key actors have been trained, then it will kick in. It depends on how fast this is done, but it's going to commence in January.
That was the Commissioner of Health, Professor Baba Malam Gana, who gave assurance that the people of the state under Governor Zulum will continue to access modern healthcare services in an easy and affordable manner. Well, viewers, with this, we have come to the end of this week's edition of Borno Health Update. We hope you enjoy the program. Join us next week for another segment. Until then, I am Ibrahim Amarawa saying bye for now.